list of important medical words which are used in hospital. I am going to discuss one by one. Diagnosis, identifying a medical condition. Treatment, medical care provided to improve or relieve a condition. Symptoms, observable indications of a medical problem. Prognosis, predicted outcome of a disease. Medication, prescribed drugs for treatment. Admission, entering the hospital for medical care. Discharge, leaving the hospital after treatment. Surgery, medical procedure involving incision or manipulation. Anesthesia, loss of sensation, often used during surgery. Rehabilitation, process of restoring health and normal functioning. Therapy, treatment to relieve or heal a disorder. Radiology, medical imaging techniques like X-rays. Lab results, findings from medical tests or analysis. Emergency room, ER department for immediate medical attention. Intensive care unit, ICU specialized unit for critical patients. Vital signs, essential body functions like heart rate and temperature. Patient history, record of a patient's health background. Nurse, healthcare professional providing patient care. Physician, medical doctor responsible for patient treatment. Ward, hospital section for patients with similar conditions. Pharmacy, dispensing and managing medications. Ambulance, emergency vehicle for transporting patients. Consultation, meeting with a medical specialist for advice. Chronic, long-term medical condition. Acute, sudden and severe medical condition. Inpatient, a patient admitted to the hospital. Outpatient, a patient treated without staying overnight. Genetics, study of genes and heredity. Biopsy, removal of tissue for examination. Pathology, study of diseases and their causes. Epidemic, widespread occurrence of a disease. Palliative care, supportive care for serious illnesses. Pediatrics, medical care for children. Geriatrics, medical care for elderly patients. Hematology, study of blood and blood disorders. Oncology, study and treatment of cancer. Gastroenterology, study of the digestive system. Neurology, study of the nervous system. Cardiology, study of the heart and blood vessels. Endocrinology, study of hormones and endocrine glands. Allergy, hypersensitivity to certain substances. Immunization, vaccination to prevent diseases. Intubation, insertion of a tube into the body. Infection control, measures to prevent the spread of infections. Isolation, keeping a patient separated to prevent spread. MRI, magnetic resonance imaging technique. CT scan, computed tomography X-ray imaging technique. Ultrasound, imaging using sound waves. Phlebotomy, drawing blood for medical tests. Hypertension, high blood pressure. Hypotension, low blood pressure. Respiratory, relating to breathing. Gynecology, study of the female reproductive system. Obstetrics, care during pregnancy and childbirth. Dermatology, study of skin conditions. Orthopedics, study of musculoskeletal disorders. Psychiatry, treatment of mental disorders. Urology, study of the urinary system. Nephrology, study of the kidneys. Ophthalmology, study of eye diseases. ENT, ear, nose, throat, specialized medical field. Anatomy, study of the structure of the body. Physiology, study of the function of living organisms. Pharmacology, study of drugs and their effects. Thrombosis, formation of blood clots. Hemorrhage, excessive bleeding. Aseptic technique, sterile medical procedures. Catheter, tube for draining fluids from the body. Pulse oximeter, device to measure oxygen saturation. Antibiotics, medications to treat bacterial infections. Antiviral medications to treat viral infections. Anticoagulant medication to prevent blood clotting. Pulse, rhythmic beating of the heart. Arrhythmia, irregular heart rhythm. Fracture, broken bone. Sprain, injury to a ligament. Strain, overstretching or tearing of muscles. Triage, prioritizing patients based on severity. Quarantine, isolating to prevent disease spread. DNR, do not resuscitate medical directive. Homeostasis, maintaining stable internal conditions. Inflammation, body's response to injury or infection. CPR, cardiopulmonary resuscitation life-saving technique. Stethoscope, medical listening device. Sutures, stitches to close wounds. Nebulizer, device for inhaling medication as a mist. Biometrics, measurement of biological characteristics. Diuretic, medication promoting urine production. Diuretic, medication promoting urine production. Cathartic, medication promoting bowel movements. Endoscopy, visual examination of internal organs. Hemodialysis, blood cleansing procedure. Pacemaker, device to regulate heart rhythm. Ventilator, device aiding breathing. Circulation, movement of blood through the body. Cytology, study of cells. Colonoscopy, examination of the colon. Lumbar puncture, spinal fluid collection. Placebo, inactive substance for comparison. Rehydration, restoration of body fluid balance. Xenotransplantation, transplanting organs from animals. For more information, like the video and subscribe the channel.